Hello everyone, it is princess_mini4 and welcome back to my channel. And today's video is going to be like a little health update and yeah. If you guys are new here, please make sure you hit that notification bell and hit that subscribe button so you never miss a post. Alright you guys, so the day that I am filming this video, today's date is Wednesday, June 18th, 2025. So pretty much, hold on, let me see. On March 29th, I had a heart MRI and I actually have filmed a video. It was like a little day in my life or whatever. I had my heart MRI, then I went and got me some breakfast, and then all my rest of the things I do for the day. So, but the reason why I had a heart MRI, so let's go back to 2020. I started going to this place for cardiology. And the reason why I started going here was because of chest pain, which I have chest pain every now and then. Like, I just feel like for some people it's normal. And every time you have chest pain, it's not always like heart stuff, because now a lot of my chest pain is like right here with my acid reflux, which has been going not bad lately. Like, that's actually not been doing that bad, but I got tests coming up for that. I gotta do like an upper GI and all that stuff. But yeah, I've been making little like dietary changes, so it's actually been better. So that's probably all on my fault. But anyway, but back in 2020, I started going to this place. It's a heart and lung hospital. So it's specifically for like, pulmonary issues, heart issues. Of course, you can go there for whatever. But if I ever have any kind of heart or chest pain, I always go straight to this hospital because that's what they're known for. So I feel like they're gonna save me better than a regular hospital. But yeah, so I started going there for that. I went there, got a whole blood lab drawn up. My cholesterol was high. My cholesterol been high for a long time. I think in 2022 is when I first started taking rosuvastatin and calcium, which I'm still going to be taking that probably for the rest of my life because high cholesterol does run in my family. And every time I go on it, it goes down. I go off it, it goes right back up. But the way I eat is probably the reason, and because it runs in my family. So it's just something that, another thing that also runs in my family is hypertension. So like, I'm on like red alert to these people because all this stuff runs in my family, and because of the color of my skin, we tend to have hypertension. We put too much salt on our food, but little things like that. So yeah, let's go back to May 5th. I went for a routine echo, which an echo is a ultrasound of your heart. Where is that? They call it a transthoracic echocardiogram for some reason. I don't know what that means. But I went there, I got my blood work done because it had been about 6 months since I had blood work. So I went there at 7:30 in the morning, had my blood work done. Then I was sent for an echo. So I had my echo. Oh, that's my thing's name in the other room. My Alexa's name, well, my grandmom's Alexa's name is Echo. Heart ultrasound, and it's probably in there going like, anyway, I had a heart ultrasound that day, went home, went about my business, I don't even really remember, did I film that day? It was Cinco de Mayo. I don't think I did anything else that day. No, I came home and I had to do schoolwork because I was still in school. So whatever, the next few days, I'm in class. Every time I had to go to class, I always had to turn my phone off. And y'all know how when you have an iPhone, sometimes when you get a phone call when your phone is off, it doesn't always tell you. Like, a lot of times it'll have like the little one notification on the phone app, but sometimes it doesn't tell you at all. So if you call me and my phone's off and my phone doesn't tell me, I don't know that you tell me that you called me. It doesn't even say that I had a missed call. So my cardiologist was calling me. And I'm like, I didn't even know, right? So I'm coming home from class one day, let's say Wednesday the 7th, and my grandmom is like, she texts me, literally, I could probably go up and find it. Why aren't you answering your cardiologist? I'm like, what do you mean, why am I not answering? He didn't call me. She's like, he said he called you a few times. Because he called me so many times I didn't answer that he called my grandma because she's like my emergency contact. And I'm like, dang, there must be something wrong. Like, for your cardiologist to call you like that, something gotta be wrong. So I'm like, okay, I said I'll call him. I called him back. Of course, he never picks up the phone. And then they send it to like his nurse, his lead nurse. She doesn't pick up the phone. So I'm like, so I shoot him a message on like the little My Chart. I'm sick, by the way. Sorry about that. So I sent him a little message on the My Chart thing. And I'm like, look, we've been playing phone tag. You've been calling me. I ain't been answering. I've been calling you. So he said, all right, I'll call you tomorrow at this time. Because I said, I'm in class from this time. My phone has to be off. So he calls me and he says, so we found this thing on your echocardiogram and you need to get a heart MRI. And I'm like, wait. Slow down. What are you talking about? So I'm trying to see. So they found, like, obviously they have all these, like, just, I don't know nothing about all these, like, size things, like, 55%. I don't know what none of this stuff means. I mean, I'm not a cardiologist and I'm not a tech, and I don't think they really know either. They just have to take the pictures. So it says, here are the findings. Left ventricle, normal left ventricle chamber size and wall thickness. No regional wall motion abnormalities. Non-compaction of the inferior, anterolateral and lateral apex to mid-LV wall with non-compact wall thickness 1.3 centimeters and compact 0.55 centimeters. Like, all this crazy stuff, right? I read this. It came through. I read it and I'm like, okay, because what does that mean? Like, I don't know. I went to school for medical assistant. I didn't go to school for cardiology. I don't know what none of this means. So there's a whole bunch of other things that it goes through, like your left atrium, your right atrium, your left ventricle, your mitral valve. It breaks everything down for you. But if you don't know what you're looking at, you don't know what you're looking at, right? So it says one thing that they did say. It says with a tricuspid valve, it says trace regurgitation. So I googled that because I'm like, what does that mean? That pretty much means that when your heart beats, blood flows back into your heart instead of flowing out. It's not always a bad thing, but yeah, so that's what that says. But it also says it was poorly visualized, so he's not even worried about that. So all that stuff, right? It goes through your pulmonary artery, your pericardium. Okay, cool. Everything looks fine. My blood pressure was fine. My blood pressure that day was 124/80, which is a little high for me. And they're already on alert because one time I went there, it was 146. But I'm telling y'all, when you go to this hospital, you're sitting there for 3 hours for one appointment. I went there yesterday for a 9:30 appointment. I didn't leave till about 11-ish. And I know that's like, for some people, that's not bad, but it's like, I get frustrated sitting there for that long. And my grandmom's the same way. She goes here too. They trying to get all our monies, okay? So she goes there too, and she'll go there for like a 7 o'clock appointment. Tell me why she's not leaving till 12 p.m. I'm serious. She has been there for 5 hours one time, and I felt so bad for her. And then she's like, why do they complain about your blood pressure being high? You're frustrated from sitting there for that long. So that's why I'm like, my blood pressure is normally 110 through 112, and it's always over 80. Like, literally, that's my normal. But when they see it as high, they're heart doctors, so they're like, she got high blood pressure. And I'm like, no, I don't. Like, literally. So they literally, on one of my conditions, it says I'm being evaluated for high blood pressure. I'm like, okay, whatever. So on the conclusions part, it says the same thing I said, non-compaction of the inferior interlateral whatever, right? It says normal right ventricular size and systolic function, no pericardial infusion, and no significant valvular disease, right? So I read all this, did my little Google, I went about my day. So now he's calling me. You need to have a heart MRI because we think we found non-compaction myocardiopathy, blah, blah, blah. So I'm like, okay, you know, I Google it. And when you Google what he first told me, which was non-compaction myocardiomyopathy, I'm gonna show you what it is. This right here, non-compaction cardiomyopathy. So I Google it. It says NCM is a rare genetic heart condition that occurs when the left ventricle doesn't develop properly during embryogenesis. The genesis? Yeah. So pretty much when you're being born, or no, when you're being created in the womb, it doesn't fully develop, pretty much. That's what I got from that. There's no cure. There's no way to prevent it. Like, this is all I literally just Googled. I haven't gone past here. And that's what it looks like in the heart. It has that little spongy thing right there. So it's not a full muscle, right? Okay. So cool. Fast forward from May 5th to May 29th. I go in for my heart MRI. They put the thing in my vein and it don't hurt. Watch my vlog. You had to breathe in, breathe out, hold. They put the contrast in, whatever. I go home, I go about my time. Boom, I'm getting ready to have a surgery. I'm getting ready to have a diagnostic laparoscopy. I don't know which one comes out first. I think that video comes out first. So literally, in order for me to have that surgery, because my surgery was booked weeks before my surgery. My surgery was June 5th. It was booked weeks before even this heart issue came up. I go to her for my for like an annual before my surgery, right? I go to my GYN and I tell her, I was like, is this going to affect my surgery? She said, well, definitely. So you need to go to your cardiologist and have him send over a note saying that, pretty much giving me clearance to have surgery. Which, mind y'all, if this is something I was born with, I had my wisdom teeth. No, I was like 7 years old when they put me under for an MRI. That's the first thing of anesthesia. Wisdom teeth, anesthesia. Tonsils removed, anesthesia. Weight loss surgery, anesthesia. 3 plastic surgeries, anesthesia. I've been put under 6 times and there was no issue. But now I needed clearance. Okay, so I was irritated. And literally June 4th at 5 p.m. I got clearance. I was going back and forth. They called me like 12 p.m. All right, no, girl, you can come in at 7:30 for your surgery tomorrow, you know, blah, blah, blah. Don't eat past midnight, all this, all that. I'm like, okay, cool, you know. And then I'm like, okay, so they already got clearance. Wrong. I got a call 10 minutes later. We can't do your surgery until we get clearance. And I've been contacting your cardiologist and he has not been answering. And I'm like, but they just called me and said my surgery was tomorrow at 7:30. She's like, yeah, well, that's the scheduling center. They don't really know what's going on. So they just call people, whatever. So now I'm like irritated. Because now I'm like, oh, so now I'm not getting my surgery. Sorry for spitting. I'm like, I got a lot of saliva today. So whatever. So now I'm calling my cardiologist. The lady's calling my cardiologist, and I gave her a big thank you. I was like, thank you, Lord, for her. Because she fought for me. She kept calling them. They're not answering. She's calling them, leaving emails. She's doing all this stuff that she does not have to do. This is not her job. I mean, it is her job, but it's not her job, for real. You know, because my cardiologist was being, you know. So then I get a call back. So I call my cardiologist, no answer. Then I leave a message on the thing. Then I finally get a call back and she's like, we just got your MRI results. They're reading them right now. Just stay patient, stay with me, blah, blah, blah. I'm like, okay. So then about an hour later, it's 5 o'clock. My cardiologist calls me. So here's what it says. So I got good news and bad news. The good news is I was able to go for my surgery. The bad news is that I did have that heart disease. That's the bad news. The reason for the exam was they thought that I had left ventricular non-compaction cardiomyopathy. So there's no comparisons. I only had one MRI my entire life. I'm not gonna read all of this stuff because it's like all these little terms and stuff I don't know. Findings. Where's the findings? Hold on, y'all. Findings. Well, they took morphology, tissue characterization, and function. There's like... Anyway, they found the... here's the official name. Let me turn this fan off because it's making my voice dry. My like throat dry. So it's called left ventricular non-compaction cardiomyopathy, or just LVNC. So that is what I have, literally. So it says the lower left chamber of the heart, called the left ventricle, contains bundles or pieces of muscle that extend into the chamber. So as normal development progresses, they become compacted, transforming the heart muscle from sponge-like to smooth and solid. And what I have, compaction does not occur. Now my nose is running. So that's why it's called non-compaction, because it doesn't compact. So pretty much my cardiologist described it to me like this. When you're being formed in the womb, your muscles in your heart start going like this. But when you have non-compaction, they stay like this. So it's not a smooth muscle like this. Instead, it's just like this. So, like I showed y'all in that picture, I'll show you another one. You see how That's a normal heart. That's my heart. It has all those little things. So blood is not going to accurately, you know, pump throughout the heart. So, you know, and my uncle asked me yesterday, and I was completely honest. He was like, how do you feel about this condition? I'm like, I don't know yet. It's so new. I just found out like a week ago. I don't know. So, yeah. So I had my cardiologist appointment yesterday. I came with all these questions. Look at all these questions. I came with all these questions. I did record everything, but I'm not going to obviously play that back because that's illegal. So I asked him pretty much what it is, and that's how he explained it to me. I said, how severe is my condition? He said, my heart, pretty much what they check for, now I'm hot. Pretty much what they check for is your heart rhythm, which is your EKG, and just how your heart is beating and how it's functioning. So when they did the MRI, they said mine is pretty much completely normal, you know, which when he said pretty much, I'm like, pretty much don't sound good. But he was like, it's pretty much normal heart function. So it's not like extremely severe now, but I said, will it worsen over time? And pretty much the answer is yes. Your heart function will worsen over time. So, I said, what caused it in my case? That's where they don't know. So let me read this, let me read this to y'all. I'm sorry for being sick. I'm just always sick, y'all. So I went in there yesterday. My blood pressure was 112/80 on my left, 110/80 on my right. My respiratory rate was 16. My heart rate was 66. Yeah, my SpO2 was 100. So everything looking good with that. I was 155 though. We gotta lose some weight. That's all the medication I take. Yeah. Cardiac MRI revealed non-compaction, blah, 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 right? My exercise treadmill test, which I did last year, and my Holter monitor was unremarkable. There's no issues in my heart. They found no, like, rhythm issues, no, like, what did they said that on here. What they call it? Like, I forget the name. It's been a minute since I've been in school, y'all. They didn't find anything bad on those. So, yeah. Pretty much, so my cholesterol was normal in my last test. I had cleared her for diagnostic laparoscopy. She found to have endometriosis and a cyst was removed. I came for follow-up and I denied chest pain, shortness of breath, or palpitations. So yeah, which I do every now and then have a palpitation that has shortness of breath, but it's literally every blue moon. And chest pain, again, is every blue moon, but now it's a little bit more often because of the acid reflux. So yeah. Let me see. Yeah, my Holter monitor was last year and they found nothing. Then they have all my results, everything being normal. Blah, blah, blah. They found no heart murmur, which is good. No wheezing in my lungs, none of that. No edema, no cyanosis. Everything is good. But my assessment is left ventricular non-compaction cardiomyopathy. It's acute. I have hyperlipidemia, which is high blood pressure. High cholesterol, even though it's being good now, but as soon as I get off, it goes back up. So then they have me as elevated blood pressure reading without diagnosis of hypertension. So yeah, she denies chest pain, shortness of breath, or palpitations. Yeah. The Holter monitor in 2020 and in 2025 shows no evidence of significant supraventricular or ventricular arrhythmia. So my heart is good other than that, really. So today we discussed the prognosis and natural course of this condition. I have started her on lisinopril, so I will be starting lisinopril pretty much on Sunday. So Sunday's date is the 22nd, June 22nd. I will be starting lisinopril. I have to take that for 2 weeks, and then I have to go and get a blood test. And I have to go and get a blood test because it may affect with my kidneys. I'm like, if it's not one thing, it's another, y'all. So that I'm starting lisinopril, literally only a 2.5 milligrams. And the reason why I'm taking that is to prolong the weakening of my heart muscles, pretty much. So I take this now, and then so hopefully in 10, 15, 20 years, my heart muscle rhythm and stuff is still the same, instead of it weakening over time, which, like he said, it will because of the condition. It says she has bradycardia with her home heart rate readings, which are usually between 50 to 58, which I have this smart ring right here, and I have my Apple Watch, and right now it's probably a little bit higher because I'm talking, but 17 minutes ago it was 57 beats per minute. So he was going to start me on a beta blocker, but beta blockers lower your heart rate. They don't want to lower my heart rate lower than that, so that's why I'm taking lisinopril. So, well, I will be taking lisinopril, and hopefully it doesn't bother me. Because as lisinopril is also for high blood pressure, so it's going to lower my blood pressure, and my blood pressure is like 110. So it's going to be a trial and error, but pretty much I'm just letting y'all know what's going on now. So there are different presentations of LV non-compaction, blah, blah, blah. One of them is Barth syndrome, which is associated with LV, NC, and bradycardia, involving a tafazin gene. And the other kind is called isolated. So pretty much what they're trying to say, they don't know what caused it in my case. It's either I was born with it, which you're mostly born with it, because you can develop it from being an athlete, which I'm not, or from being pregnant, which I've never been, right? But you can also develop it in sickle cell anemia or renal failure, right? So I only have sickle cell trait. My mom had sickle cell, my dad had nothing, so I have the trait. So they don't do much testing on sickle cell. It's a black person's disease. They don't do much testing. They know that sickle cell anemia can cause what I have, but they don't know if the trait can cause it. So it could be from the trait. I could have not been born with it, because I find it weird that I've had 5 echocardiograms in my life and they found it on the 5th one, right? I think that's a little weird. So I could have developed it over time from having sickle cell trait. It could have been a gene from my mom or from my dad. They're both deceased, so I can't have them go and get an echocardiogram. So my best bet is to ask my brother, which I have 2 half brothers. I have a brother, me and him share the same mom. I have another brother, me and him share the same dad. We don't know which parent has the disease, particular, the heart disease. We don't know which one has it. So they both have to go and get an echocardiogram, and if they have it, then they're going to assume it's genetic, and then I will be able to get a genetic study done to see what actual gene caused it. So that's pretty much what we're doing right now. I contacted both of my brothers, and I'm gonna read to y'all what I said. I had a concerning echocardiogram. Then I was sent to get a heart MRI, and they discovered I have left ventricular non-compaction cardiomyopathy. They are trying to determine if it's genetic or reversible, because if it's reversible, certain things, like obviously if it's when you're pregnant, then it will reverse over time, or is it something that I'm just going to have forever? They don't know yet, because they don't know where it came from. So since I have no living parents, they recommended me to contact my siblings to see if you guys have it as well. So they recommend you to get an echocardiogram. So right now I'm waiting on them. They have to go and get one done, get the results, and let me know the results so I can contact my cardiologist and we go from there. So yeah, see, if any of them have it, then I will be a candidate for genetic study. So that's pretty much what it is, y'all. I have heart disease. It's kind of crazy. I did ask him, what symptoms should I watch for as it progresses? He says chest pain with palpitations and shortness of breath. So I said, should I limit physical activity or exercise? He said no. I said, are there any dietary changes I should make to support heart health? He said, no. I find that strange because I will start making dietary changes. I'm literally going to just go full diet reset, y'all, because I want to live a long life. I want to live a long, happy, and healthy life. And I don't want to have my diet be the reason why it got worse. You know, my diet may not affect this thing at all, but I just want to eat more heart healthy foods and just eat less how I eat. I eat a lot of sweets. I mean, I've been gaining weight. It's kind of common sense. I eat a lot of unhealthy foods, a lot of fried foods, a lot of fast foods. You know, I don't drink a lot of soda, but I've been drinking soda. You know, I'm just really I need to just change how I eat, you know? So I said, what is the long-term outlook for someone with this? Like, will I die tomorrow? Will I die the next day from the heart disease? He said, as long as my heart rhythm is looking good, then I should be fine. Obviously, when you look this up, it says things which are kind of scary. It says things like complications are heart failure, arrhythmia, sudden cardiac death, and thromboembolic events. That's pretty much like a blood clot going in there. So that's not really good. Like sudden cardiac death and heart failure, this does not sound good, you know? So that's pretty much what will happen probably over time if I don't continue the medication, I guess. So there's still a lot I'm still trying to learn. Pretty much, I'm hoping that this isn't something that's like genetic, because I still really do want to have kids despite having endometriosis stage 2 and now having a heart problem. But if I find out that like something like endometriosis is genetic or like heart disease is genetic, I probably won't have children, because that's not fair. You know, I know what I have, and I know that it has a possibility of being, you know, carried down. I would hate for my daughter to have endometriosis because I know how bad my period is. And I would hate for my child to have this heart disease. You know what I'm saying? So I probably won't have kids, at least from me. Like maybe I'll do IVF down the line and use like a different egg, but I don't want my kid to potentially have neither of the things that I have. So, you know, there's a lot that I got to think of. Like I said, my uncle asked, how do I feel about it? I'm like, it's so brand new. I don't really know how I feel. You know, I'm a child of God, and I know that everything that happens in my life happens for a reason, and he's not going to give me anything I can't control, I can't deal with, you know. And I know that at the end of the day, he has the final say, you know. And I know that there are a lot of people that have heart disease and cancer and stuff, and they don't die from it. Like they could die, like think about it, y'all. You can die any day, anytime. You could wake up today and not go to sleep tonight because you passed away. You can die in a car accident. Anything, y'all. Like there's so many ways. There are so many ways you could leave this earth. Y'all, there are so many ways. So I could sit here and die in 5 years and it's not from this heart disease at all. It could be from something else. It could be from a fluke accident, like plane crashes, like anything, y'all. So it's like I'm trying not to worry about it. You know what I'm saying? Because I am a really big worrier. And honestly, I'm so not worried about it. Like, I don't know. I mean, maybe it's because I'm secure in my faith right now and I'm working on my faith with God so hard, you know, but it's like, it doesn't worry me. And that surprises me. It surprises me that it doesn't worry me. And the funny thing was, it worried both of my brothers because neither of them answer me quick when I text them, which is okay. The thing about texting, you don't have to answer me right away. But I'm telling you, I sent this message to both of my brothers. They answered me back right away. I said, oh, y'all are worried. Like, but I'm just so not worried about it. Because at the end of the day, I know who has the final say. And it's like, it is what it is. Like, what did I say? My motto for this year. It is what it is. So, yeah, y'all. I just pretty much just wanted to let you guys know. I always want to put this kind of stuff on YouTube because I'm just a very big of trying to help other people. And, you know, so I will pretty much probably do other videos, probably updating you guys how it went with the new medication. So he renewed my Rosuvastatin calcium, which is Crestor, for my whatchamacallit, my high cholesterol, then I will be starting lisinopril 2.5 milligrams daily. So those are the 2 pills that I'll be taking for my heart health. I will be doing like dietary changes for real, because I really just need to lock in and stop eating the way that I've been eating, especially since it's also causing other problems, right? Like, I've adjusted really easily to stop drinking coffee. You know, I've been drinking a lot of tea and just kind of just, you know, so there's little things. I'm just gonna have to start making big dietary changes and life changes. Right now I'm still recovering from my surgery, so I'm not working out, but I will start back that soon. And you know, I'm just gonna be real big on heart health and everything, y'all. But this is the update. I know it's a long video. I talked for 30 minutes. I am sorry, but you know, my brain was all over the place. But yes, thank you guys so much for watching this video. Please make sure you like, comment, and subscribe. Turn on the notification bell to know when I post, and share this video with your friends. And I will probably make another playlist for like my body issues or whatever. I don't know what I'm gonna call it, but I'm gonna do like for my endometriosis, which that's gonna be like a whole separate video. That video's gonna come out after this, because I haven't gone to my post-op yet and we haven't talked about those choices. And the thing is, if she wants to start me on a medication, I'm never gonna take birth control, especially now since I have a heart disease and birth control can cause blood clots. He's definitely not gonna want me to be on birth control. So, you know, if I start a new medication for that, y'all just gonna have to keep watching, subscribe, and I will see you guys in my next video. Bye guys, love you.